KIRO, Seattle. This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
Social distancing is flattening the curve, but local public health officials say we are still far from lifting restrictions.
It should be very clear to everyone that we are in no way ready to do that at this point.
So, how and when will the state reopen? Washington's new Western Alliance provides some clues.
Also, Governor Inslee signs an order protecting high-risk workers from losing their jobs, while Seattle provides some relief to small businesses.
And a Seattle coronavirus survivor donates blood to try to save other COVID-19 patients.
Stay right here.
A new model confirms that social distancing is slowing transmission of COVID-19 in the state's three big counties, King, Pierce, and Snohomish. That report comes from the Bellevue-based Institute for Disease Modeling. King County Public Health Officer Dr. Jeff Duchin says there are promising results.
What we saw early in the epidemic, where every person who was infected transmitted the disease to, on average, 2 or 3 others, we're getting closer to that landmark where each person who's infected spreads the disease to 1 or fewer others.
But the report still says the region is in a, quote, precarious state and must continue social distancing measures.
I would like to see transmission suppressed further, if possible, and have better evidence of adequate laboratory testing so we can have confidence in where we're truly at.
Meanwhile, Governor Jay Inslee says he's coordinating with Oregon and California on a shared vision to reopen our local economies. Today, we heard from those states' governors. First, Oregon's Kate Brown on her framework for opening back up. She says it'll take a slow, science-based approach.
And my 5 metrics are slow the growth of the disease, adequate personal protective equipment, testing capacity substantially increased, tracking or contact tracing, and isolation.
And California Governor Gavin Newsom agrees.
The most important framework is our capacity to expand our testing, to appropriately address the tracing and tracking of individuals, the isolation and the quarantine of individuals.
Neither Newsom nor Brown gave a specific timeline on reopening their states. Washington has not either, though for now, Inslee's stay-home order runs through May 4th. Ultimately, it seems like widespread testing will need to be in place before these states feel comfortable reopening, despite President Trump saying he has total authority to reopen the nation.
When somebody's the president of the United States, the authority is total, and that's the way it's got to be.
President Trump floated the possibility of reopening some areas in the country by May 1st. He said he could announce those recommendations as soon as this week. A new executive order protects Washington workers who are at a higher risk of getting seriously ill from the coronavirus.
Governor Jay Inslee signed the order requiring businesses to offer alternative work for employees over 65 with compromised immune systems.
Frankly, if we can wrap our arms, put a bubble around people of this ilk, of this age and condition, we're going to reduce fatality rates, well more than half.
Inslee says his order allows the workers to take leave using benefits or unemployment. It also mandates that their jobs be held for them until it is safe enough to return to work.
In Seattle, meanwhile, the mayor's office has selected 250 small businesses to receive coronavirus relief grants. They're worth $10,000 each. About 9,000 employers applied, so only 3% of applicants received assistance. They were chosen by lottery.
Most of the first grants went to salons, barbershops, food trucks, and restaurants. The city says it could offer additional grants at a later date. A Seattle coronavirus survivor just became the first in the state to give her blood to try to save other COVID-19 patients who are not recovering as well as she did. The report from KIRO Radio's Hannah Scott.
It's an old process that's been around for years, using antibodies in a recovered person to treat a sick person. And Seattle bioengineer Elizabeth Schneider is trying to find out if she can be of help.
This past Friday, I became the first person in the state of Washington to donate plasma, and the plasma will be used as what's called convalescent therapies.
Researchers at the UW, Bloodworks Northwest, and others tell KIRO 7 TV they're kicking efforts into high gear as the first patients fully recovered from COVID-19 become available in the hopes of successfully treating people with convalescent therapy.
This is really a desperate situation. As soon as we get those plasma collected, we have every intention of turning them around and start treating patients in the community.
We've been working on it like crazy just for the last couple of weeks. Thrilled to have the opportunity to try to have some mitigation of this awful disease.
Everybody is cautiously optimistic.
Here's what researchers and Elizabeth hope to find.
They are going to be testing it to see if I do indeed have antibodies, and then they're going to be, studying the plasma, but also distributing it on to be used as a therapy.
Elizabeth is among the first of a group of early survivors who've recovered, emerging across the country. She believes she and several others who later tested positive all contracted the virus at a house party back in February. For her, it was a relatively mild experience, except for one night where she admits she was a little scared.
I had a fever. My fever spiked to 103 degrees, and that was pretty high. And I started immediately involuntarily shaking, because the temperature was so high. And I started getting tingling in my hands, and I was just in so much fatigue and so tired and feeling so awful that literally, I had to very gingerly walk to the bathroom to brush my teeth and take out my contacts and change into pajamas. And I just literally crawled into bed. And I actually ended up calling a friend and seeing if she could be on standby in case I needed to go to the ER in the middle of the night. So that was really the only time that I was very worried and I was in fear.
Back then, getting tested was even harder than it is now. But she lucked out and got tested with a group of researchers at the Seattle flu study. But it still took a bit to come back. When it finally did come back positive, she had already recovered and finished her isolation time. She went public with her story in mid-March in the hopes of helping inform others and urged the public not to panic. After a bit of media blitz, it was a trip home for the much-needed visit with her parents in Arizona.
And so it was nice for me to be able to come home and to, make them feel better. It's always nice to have your family around.
Now that she's back in Seattle, she's working and confident, for the most part, that she's going to be okay, but admits there's still some unanswered questions.
It's not clear answers yet as to whether or not you can get infected again, or how much immunity you have developed and how long that immunity lasts.
For now, Elizabeth is focused on finding ways she can help others fighting for their lives because of COVID-19, many whose families she's often hearing from.
Been getting personal messages through Facebook from people all over the country who have loved ones who are fighting for their lives in the ICU because of this virus and this infection. And they're asking me to donate plasma to help cure their loved one. And it's just really heartbreaking to see. And unfortunately, the personal messages that I've received, I have not been able to help because my blood type hasn't matched so far any of the people who have messaged me.
So for now, she's waiting for results to come back on her plasma. And if they come back in the way she hopes, that will allow her to keep helping, Elizabeth is ready to literally give it everything she can.
Can donate plasma once a week, and it's safe and healthy to do that. So once I'm confirmed that, I do indeed have the antibodies, I will be going back and donating once a week, because as long as I have antibodies, I want to make sure that those antibodies get to people who need them and potentially save someone's life.
We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.